We are all destined to die. Have you ever talked with others about this? Suppose you are ill or you've had an accident. The ambulance nurse will ask you, would you like to be resuscitated in the event of a cardiac arrest? However, what if you've never actually thought about this before? What would that mean in your situation? It's good to discuss this with your family physician and those close to you. Who can speak for you if you are no longer able to do so yourself? If you can no longer express yourself because you're too ill or because you cannot speak, someone close to you will need to make decisions for you. Have you ever thought about who that might be? How should you prepare for the future? Have you ever thought about all the practical issues? Paperwork, money matters, your will, an advance directive? Talk about it with someone you can trust, a family member, a friend, or a professional. This will give you peace of mind. Is there anything you'd like to talk about? You've experienced a lot in your life, special moments and milestones, a lot of moments to look back on. There were positive events, but also not so positive ones. You may have questions. You might want to express yourself, or something may be bothering you. Perhaps there are things that remain unresolved, situations that cause you grief. It might give comfort to talk about it with someone, a family member, a friend, or a professional. Someone with whom you can talk to about what is important, such as settling an argument, for example. This way, you can still address those things that are important to you. There will come a time when you pass away. You will either be cremated or buried. Have you ever thought about this? If your loved ones know what you want, they will be able to fulfill your wishes. Although it may be a sad subject to talk about, it can also provide relief. Have you ever thought about where you would prefer to die when the time comes? It's tough to predict how things will go, but suppose you can choose. At home, which is familiar but requires a lot of organisation, or in a hospital, with the most advanced technological means available, or in a hospice facility, where everything is arranged for you, with attention paid to your well-being and that of your loved ones. Do you know what you want? We are all destined to die. We have no control over this. However, there are certain things you can influence if you talk about them now. Would you like to know more? Please visit our website. Talk about it with your family physician and with family or friends.